Okay, guys, this is going to be your Principles of Pharmacology lecture. Side note on this one, I only want you to study this lecture. I'm going to say that again, please. Only study this lecture, okay? You guys do not need to reference anything out of your book. This lecture is based on all the drugs that you guys are going to be delivering at the state of New Mexico at the EMT basic level of licensure. Which is much more drugs than you guys are going to see on the National Registry. On the National Registry, for basics, they only ask you about oxygen, aspirin, and I believe glucose. But this is going to be much more detailed. You guys do have a cut exam on this information. We'll talk more about that during class. So please make sure that you guys refer to this often. Make sure you guys know these drugs. And bring any questions that you have to class after we go through all these drugs. Okay, so medications are a very important intervention. Okay, we want to make sure that we're giving the right medication to the right patient at the right time for the right conditions. Okay, medications are used for two different things, basically. Okay, they're there to alleviate pain. Or to stabilize or improve the patient's condition. Okay? If we do not do this in a safe and competent manner, this can lead to serious consequences for our patient, up to and including death. This is definitely one way for you guys to be found negligent, and you can cause some serious damage to your patient if you're giving the wrong medication at the wrong time. Okay, so pharmacology is known as the science of drugs. Okay, a medication is a chemical substance that's used to alleviate pain, or it's used to prevent or stabilize a disease. Vocabulary for you guys: pharmacodynamics is the process on how the medication actually works on the body. Please make sure you guys know that term. Pharmacodynamics, process of which medication works on the body. So when we're talking about a medication that's an agonist, okay, the agonist actually causes a stimulation to a receptor. You have millions of receptors throughout your body. Specifically, we're going to talk about beta receptors and alpha receptors. Alpha receptors are head to toe. They touch all the cells in your body. Beta receptors, you have beta 1 receptors, which are found in the heart, and you have beta 2 receptors, which are found in the lungs. Beta 1, you have one heart. Beta 2, you have two lungs. That's the way to remember it. You guys are going to be playing with some of these that are going to affect those receptor sites to cause some kind of stimulation. An antagonist actually binds to the receptor site, and it blocks other medications from stimulating that receptor. In your scope, you have one antagonist. You have a medication known as naloxone, and we're going to get there here in a sec. It's also known as Narcan. You're going to become very good at administering Narcan because it is used for opiate overdoses. Okay? What that does is if somebody, for example, overdoses on heroin, you guys give the Narcan to somebody. That Narcan chemical is going to kick the heroin molecule off the receptor and bind to that receptor so that the heroin molecule cannot come back and attach itself to the receptor in order to create a stimulation. Okay, so it blocks that receptor site in order to help the patient eventually, in this case, increase their respiratory drive and wake up, not overdose. Okay. The dose is the amount of medication that is given. Doses are dependent on weight, age, and desired effects or desired actions that we're trying to get out of that medication for our patients. When we're talking about the action of the drug, it's also known as the therapeutic effect. What are we intending this drug to do for our patient when we give it? Okay. The indications of the drug are the reasons or conditions on why we give that drug to our patients in the first place. Okay. Contraindications. Contraindications are similar to allergies, or like if a patient has allergies to penicillin, that would be a contraindication. It's going to produce some kind of harmful effect, okay, to our patient. We have absolute contraindications, such as an allergy to that medication. If the patient already knows they have an allergy to that medication, we don't want to give them that medication because we can make the patient much worse. And then we have relative contraindications. And we're going to talk about relative contraindications as we are going through the drugs individually in this lecture, because there are some caveats to a relative contraindication. A relative contraindication is basically we're going to kind of weigh the risk benefits of the contraindication for our patient in their time of need before we actually give the medication. Side effects are completely different than contraindications. Okay? Side effects are any unintended or untoward effects. You guys would be given a medication for medications out there that could cause a patient to have headaches. That's a side effect. You can give medications for somebody that might experience nausea all of a sudden. That is a side effect. That's not a contraindication. That's a side effect of the medication that you're given. Okay, most medications out there, most medications have two different names. One is the generic name, which is a non-proprietary name. Okay, it's basically the original chemical name of that medication. For an example of that, I give you guys ibuprofen. Okay, the generic name is what is found in a book known as the U.S. Pharmacopoeia. All the drugs that the FDA has approved are in this book called the U.S. Pharmacopoeia. It is huge. Okay, it's a very thick book, and it goes by the generic name of the medication. The trade name is what the manufacturer's brand name is. So this is like the stuff that you see on the shelves at Walgreens, such as Tylenol. Tylenol is also known as ibuprofen, but the trade name for it is Tylenol. Okay? Some drugs can have more than one trade name as well. Okay? The big thing I want you guys to take home, and this has been shown on tests, this has been shown on the National Registry, generic names are always lowercased. Okay? The chemical name of the medication, such as ibuprofen, is always lowercase, compared to the trade name of that medication, such as Tylenol, is always capitalized. So you will not find Tylenol in the U.S. Pharmacopoeia. However, you will find ibuprofen in the U.S. Pharmacopoeia if you guys are there to look up medications. For medication names, we also have prescription medications, over-the-counter medications, illicit street drugs, herbal medications, some enhancement drugs such as like your steroids or your human growth hormones, and of course all the vitamin supplements out there. In EMS, we're really kind of concerned, obviously, about prescription medications. We're worried about some over-the-counter medications, some vitamin supplements, pretty much all those except for really herbal medications. We don't really concern ourselves with homeopathic treatment in EMS. That'll change a little bit as you move up in level of licensure, because there are some homeopathic drugs out there, or herbal drugs, that actually act like prescription medications, but you guys will get that as you move up to higher levels of licensure. Okay, so when we're talking about routes of administration, we have two different main types of routes. We have enteral and parenteral. Okay, enteral medications enter the body through the digestive system. These are often like a pill or a liquid form, such as like a cough medicine or like an ibuprofen or something like that, something that you would like take for a headache or something like that. Medications that are administered this way, because it has to travel through the digestive system, they tend to be absorbed slowly. It takes a little while for them to kick in, and they're commonly not used in the emergency setting. You guys really don't have too many enteral medications that you guys play with, although there are a couple that you guys do play with, okay? However, when we're talking about parental medications enter the body any other way besides the digestive system, okay? So it could be entered through the veins, such as like an IV. It could be entered through the muscles or the subcutaneous tissue of the skin, such as like a shot, like you would get at the doctor's office. It could be entered rectally. We don't do any rectal drugs. You guys won't do any rectal drugs all the way up to paramedic. This is usually a fluid, a liquid form, and it's administered through needles or syringes. It's absorbed very quickly and often more predictable with the actual response that you're going to get from the medicine, because you have a lot more control over a parenteral medication than you do an enteral medication. So make sure you guys know the difference between those two. Okay, some more routes. When we're talking about absorption, how that drug is actually absorbed into the tissues and into the bloodstream. That's the process that the medication does. Okay, so the medication is actually going to travel through the body tissue into the bloodstream in order for that drug to get dispersed throughout the body to hopefully hit whatever target we're trying to hit, whether it's pain relief or possibly some kind of stabilization of whatever disease process the patient actually has. Some very common routes of administration is per rectum, which is by the rectum. We do not do any of those. I just mentioned that. We do not do any of those in EMS at all. And even nurses only do some. But from basic to intermediate to paramedic, we have no rectal drugs whatsoever. Oral, also known as per os, it's abbreviated PO. That is by mouth, okay? When we're doing by mouth, it enters the bloodstream through the digestive system. It could take anywhere between 30 to 60 minutes for the actual absorption to occur. There are some pros and cons. Some pros, it's a very non-invasive procedure. We just have to have the patient swallow it. And it's much less expensive than the liquid forms of medications if we're going to do the parenteral routes. Some cons of it. Cons, definitely, it's unpredictable. Okay, we have no control over it. It's literally a pill, and that's it. Where if we have a liquid medication, we can really control how much we're giving that patient. And absorption can be affected by possible nausea or vomiting, diarrhea, any kind of upset stomach, any kind of GI upset that is going on with the patient when we give it. All right. The ODTs, what we call ODTs, are the orally disintegrating tablets. These are literally put directly onto the tongue, and the patient doesn't swallow them. They actually just dissolve. Which actually makes it a little bit more cumbersome for the patient. It actually kind of gets absorbed through the mucosa of the oral pharynx, the lining of your mouth. And it can actually, with ODTs, it can work a little bit faster than if they just swallow it. When we're talking about intravenous, this is IV. You guys do not have any drugs because you guys don't start IVs as a basics. IV is basically intravenous. It goes into the vein. It's the fastest delivery, but cannot be used for all medications. That medication has to be a liquid or a powder that is actually reconstituted into a liquid, which could take a long time to do. We're going to talk about that more a little bit later on this semester. But you guys do not do any intravenous medications because you guys are not allowed to start IVs at the basic level. Intraosseous is what's called it's abbreviated IO. This is actually a drill that we drill into the bone. Usually when we cannot establish an IV, this is really used, it's very invasive. This is very used as a last-ditch effort to help our patients. This goes right into the bone. It reaches the bloodstream through the actual bone marrow. It requires drilling a needle into the outer layer of the bone. It could be very painful, all right? Usually we're using this, it's reserved for patients who are unconscious as a result of cardiac arrest or some kind of extreme shock. And it could be used for children who have, they're not fully developed, so it could be hard to find a vein for an IV in the first place. Again, this is something that you guys don't do. I want you guys to know that it is out there as a route, but this is not something that you guys will be performing until you move up in level of licensure. Next, we have subcutaneous, which means beneath the skin. There's a couple different ways to abbreviate this. You'll see it as SC, you can see it as SQ, or you can see it as sub-Q. Okay, this is an injection. All right, it goes beneath the skin. The injection is given into the actual fatty tissue of the skin, not necessarily into the muscle. Okay. Subcutaneous, they do kind of absorb quickly, but not as fast as if you actually injected this medication right into the muscle. Okay, great examples of these are some forms of epinephrine and daily insulin injections for our diabetic patients. Okay, you guys are allowed to give subcutaneous injections, and we will be practicing these in class as well. We also have intramuscular injections. This goes straight into the muscle. You guys are allowed to do this. In fact, this is one of the more common ways you guys are going to be given medications. This goes straight into the muscle. It's absorbed pretty quickly, anywhere between probably about 3 or 5 minutes. Unfortunately, not all medications can be administered through the IM route. Some examples, which we'll talk about later. We're going to talk about the EpiPen, which is an auto-injector that some people carry because they know they're allergic to something. And then we're also going to talk about the Mark I antidote kit later on. It's also known as the Duodote, which is also an IM injection. Some problems with the IM injection, it could actually damage the actual muscle tissue of our patient. Again, that's not something to really write home about, but it's something to kind of keep in mind, specifically in some of our older patients, and we'll talk about that a little bit more. It can also be kind of an unreliable absorption, specifically if our patients have poor tissue perfusion, if their heart's not working appropriately, or they're kind of going into the shock and there might not be blood going to that muscle. It can have some problems that way. It's very rare, but you guys can do an intramuscular injection. We're going to talk a little bit more about those in some upcoming slides. Okay, carrying on with the routes. Inhalation. This is inhaled. It's actually goes straight into the lungs. This is your fastest way. This is your fastest route at the EMT basic level. This is absorbed almost instantaneously into the bloodstream. Because it's being inhaled, because it's going into the lungs, it minimizes the effects of the medication in other body tissues. Those lungs really kind of suck that up. There's different kinds of forms when it comes to inhaled. We have aerosols, which you guys will be working with. Fine powders, we really don't work too much with fine powders until you kind of get up to paramedic, and even that's very rare, or sprays. And we can, you guys do have a form of a spray that you guys will use for a certain medication. We'll talk about that once we get to that medication. So yes, you guys can do inhalation routes of administration. Sublingual, it's abbreviated SL. This is basically a pill that goes underneath the tongue. It's absorbed under the tongue, and it enters through the oral mucosa under the tongue and is absorbed into the bloodstream within minutes. It's pretty quick, guys. Okay, it's faster than the oral route and protects the medication from chemicals in the digestive system, such as like your acids that can actually weaken the medication or make them inactive if that medication had touched that acid. So it is absorbed underneath the tongue into the mucosa lining of the oropharynx, and that's how it gets into the bloodstream. Transcutaneous or transdermal, they're both used interchangeably. This is through the skin, so this is like medication patches or like icy hot topical kind of solutions, right? It's goes through the skin. It's applied as a patch to the skin. It's longer lasting, so it's kind of a little bit more of a steady dose than like a real quick one, like if we just gave it a shot. Some examples is like a nicotine patch, right? Nicotine patch is the perfect example of a transcutaneous medication route. There are some pain meds that can be given through a medication patch. And then there's also nitroglycerin. I'm going to talk about nitroglycerin patches here in a little bit when we actually talk about nitroglycerin, okay? It's very rare for us to have a transcutaneous or transdermal patch. This is mostly done in the hospitals. When we're talking about intranasal, intranasal is kind of like inhalation, but it's actually administered through something called a mucosal atomizer device, or what we call the MAD device. And I got a picture of that coming up for you so that you guys can see it. And you guys will be playing with this as well in lab. When we're talking about intranasal, it's a relatively new format for the delivery of medications, specifically for EMS. Medications are pushed through this MAD device that aerosolizes the liquid for faster delivery into the nostril. It's very quick absorption. Some examples, and some of you guys might have already had that. Sometimes for flu vaccines, you have a choice. You don't have to get a shot. They can actually give you an intranasal route if you want to go that way. And we're going to talk about naloxone or Narcan, which is going to be the number one drug that you guys are using for intranasal administrations. This here is a real quick kind of down and dirty routes of medications. This is a table straight out of your book. It's found in chapter 11, which is your pharmacology chapter. It lists the common routes of medication and the rates of absorption. But just remember for this one, and it breaks them down into enteral and parenteral medication kind of routes, I guess is the best way to put it. But just remember, you are not doing the per rectum in the enteral and the parenteral. You do not do IVs. You do not do IOs. And you have no transcutaneous medications in your scope at the EMT basic level.